This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, I thought we could talk this morning about a special patient population that we get to take care of, and those are patients with Down syndrome. Yesterday was March 21st, or 3/21, which is celebrated by the Down syndrome community as a day of celebration for Down syndrome, as Down syndrome has 3 copies of the 21st chromosome, or Trisomy 21. And so today, about 1 in 700 births is born a child with Down syndrome, and back in 1990 that was 1 in 1,000. So the numbers of these patients are going up, and they're living longer. In the 1980s, the average lifespan for a patient with Down syndrome was 25 years, and today it is 60. And so as we consider that more people are being born with Down syndrome and they're living longer, we're going to encounter these patients in our emergency department more often. Thankfully, here in Colorado, we have a lot of resources for patients and family with Down syndrome, including the Global Center for Down Syndrome is located here in Colorado, as well as the C Center and the Research Center for Down syndrome. So they serve all levels of patients from childhood to adulthood. And in October of last year, they released the first medical guidelines for adults with Down syndrome in JAMA, the medical journal. So just some things to think about when we think about these patients. In childhood, they are delayed, both physical and intellectual delays, and require additional therapies in the first 3 years. They are at increased risk for childhood leukemias, as well as seizures, low thyroid, and celiac disease. As adults, they have an early onset of Alzheimer's. And children with Down syndrome, about half that are have a cardiac defect requiring surgery at birth. So you may see both children and adults with cardiac defects. As children, they're 26 times more likely to have moya disease. That's a abnormal vessel formation in the brain that puts you at an increased risk for stroke. So as we are a stroke hospital, something to keep in mind. As you see these patients, remember to provide them the best medical care, help communicate with them as they often have speech delays, and let's see, what else? Understand that they are fully capable of anything. If you want a feel-good story right now, ESPN is airing 17 Hours, the Chris Nickett story. It's about a 21-year-old man who ran his first Ironman last year, and he's got Down syndrome, and he's training for Kona right now. So really cool story. Yesterday was 3/21. So.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.